In this video, we will review the steps to perform autologous blood transfusion training using the Chinook Medical Gear Field Blood Transfusion Set. Recommended items for training include normal saline, sharps containers, vital signs equipment, trauma shears, and oral calcium carbonate. Additional recommended items include HPMK, blood fluid warmer with appropriate cartridge, a weigh scale, emesis basin, along with Chuck's pads. While not required or recommended for autologous transfusions, having medications present to discuss the appropriate dosage and administration recommended by the most current JTS guidelines will be helpful. This will include tranexamic acid, as well as calcium gluconate or calcium chloride. These medications are intended to be simulated, and we recommend the use of normal saline flushes or by using the normal saline bag provided, all in a separate line and not in the same line as the blood. Having epinephrine and diphenhydramine on hand will also augment discussion on transfusion reactions. When fully opened, here is the included items of the blood transfusion kit, specifically the donor side. Begin conducting the Eldon card to match the blood type of the donor. You will then open the Fenwal blood pack unit and then inspect the collection bag for any cuts, kinks, discoloration, or other damage. After inspection, we tie 2 loose knots into the bag side as well as the needle side, ensuring that they are loose enough not to prevent or impede blood flow into the bag. Next, you will apply the tube clamp to the line itself. It's easiest if you feed the needle and hub through each hole at a time, as demonstrated here. Place the collection bag and the constriction band on an insulated surface lower than the donor's heart. Apply the tourniquet to the arm and prepare the arm using the included ChloraPrep swab. Pinch the line with the tube clamp approximately 6 inches from the needle prior to removing the needle cap. Failure to clamp or pinch the line prior to removing the needle cap could allow air to enter the line, reducing the negative pressure in the collection bag or increasing contamination. Using the needle bevel up, thrust it into the vein and then remove the tourniquet. You will then unclamp the tube clamp and allow blood to begin filling the collection bag. Gently agitate the collection bag every few minutes to mix the anticoagulant agent within the bag. Place the blood bag constriction band under the midpoint of the bag and secure with the clasp around the width of the bag. This will allow the bag to hourglass around the constriction band when filling and also prevent overfilling. Note the start time and instruct the donor to open-close the fist every 3 to 5 seconds. Continue to monitor the blood flow. A scale weighted in grams can be helpful, but is not mandatory, as this process should take 10 minutes. According to JTS, fill the bag to 585 grams, plus or minus 10% if using a scale. Once filled, seal the tubing by tightening the knot created earlier and then clamp with the tube clamp between the knot and the needle. Gently remove the securing tape, and then briskly remove the needle from the arm and apply pressure. Carefully recap the needle and secure it. We recommend creating a second knot to later cut between them to minimize blood spillage. Carefully remove the constriction band from the blood pack. As a second check, the constriction band measures just under 10 inches, and when placed tip to tip around the center of the bag, conveys that the bag is appropriately filled. Fill in the blood bag label using at a minimum the donor's name, DOD ID, blood type, negative or positive, and the time of collection, and then apply it to the bag. Dispose of all biohazard items into the appropriate container. Now to cover the recipient portion of the kit. Open and inspect the Y tubing. Ensure all 3 clamps are closed. Open the bag of normal saline and hang it about 3 feet above the recipient to prevent backflow of blood into the saline. Using proper technique, spike the bag of normal saline. Open the clamp on the saline side of the Y tubing. Open the clamp on the main line and prime the line with normal saline. Gently squeeze the filter chamber to completely cover the filter with normal saline and the upper chamber approximately half full with normal saline. If using a blood fluid warmer system, attach the cartridge to the main line and prime it according to manufacturer guidelines. Open the clamp on the blood side of the Y tubing to fill with saline and then close the clamp on the blood line. Hang the blood bag next to the normal saline and aseptically spike the blood bag with the blood side of the Y tubing. Using proper technique, start an IV on the opposite arm of the donor, now turned recipient. Preference is to go with a 16 gauge catheter, as this is nearly double the flow rate of an 18 gauge catheter and will also reduce hemolysis or rupture of the red blood cells as they go back into the patient. Briefly check for IV placement and infiltrates using the minimal amount of normal saline necessary. Check vital signs in a supine position just prior to the administration of whole blood, and pay careful attention to the respiratory rate and heart rate. The blood pressure may be difficult to obtain and can be an unreliable indicator of transfusion reaction in a hypotensive dying patient. Check the blood fluid warmer power level. When using the Buddy Light blood fluid warmer system, match the red arrow to the red ring on the cartridge, close the heater unit, and then activate the unit at the battery pack. Open the clamp on the main line, and then slowly open the clamp on the blood line. Start blood at a TKO rate of 1 drop every 5 seconds, and record the time as the blood enters the recipient. Take vital signs again with careful attention to the heart rate and respiratory rate, and monitor for transfusion reactions. Continue the TKO rate for 10 minutes and then recheck vital signs. Between vital sign checks, aggressively treat for hypothermia. Consider starting an IV in an opposite location to simulate the administration of TXA and calcium gluconate, as these medications cannot be administered through the same line as the blood. During autologous blood transfusion training, do not administer these medications. If no significantly increased heart rate, respiratory rate, or other signs of severe hemolytic transfusion reaction occur, then you may increase the rate. Once increased, take vital signs every 5 minutes for the first 15 minutes and then every 15 minutes. Ensure the normal saline clamp remains closed. Once all whole blood products have been administered, close the clamp on the bloodline side